Morning. Ooh, I look dry. I forgot to put moisturizer on. I was running a little bit late this morning. But good morning, good people. I am on my way to the doctor for my 3-week post-op appointment. If you follow me on Instagram or Facebook, then you know that I had breast reduction surgery on December 10th, and I have effectively gone down from a 42H to probably about a 38D-ish, keeping in mind that I am still very swollen, not very swollen, but I'm still swollen, so they'll go down a little bit more, and then my breast will also settle. I never really talked about it much. I always spoke about, how large my boobs. That was one of the reasons that I started to sew, was because I love to wear dresses, but it was so hard to shop for dresses that would fit, because I would have to essentially buy a dress that was 2 sizes up in order to fit my bust line, and then that means that it would hang like a sack, everywhere else. So that was one of the reasons that I began to sew, because then I can make the adjustments on my own and make things fit better. So I am, like I said, 2 weeks post-op. I had been trying to get insurance to cover my procedure for years, and I had been denied 4 times. I knew a long time ago that I wanted to have a breast reduction, but I wanted to wait until after I'd had kids, because I wanted to give myself the best opportunity I could to breastfeed my babies. So with Ian, I breastfed him for about a year, actually putting the kid on the boob. And then I still pumped for him probably for another 3 or 4 months. And then with Eli nursed for about 18 months. And then I was just like, it's too much. So I waited. And then I saw a doctor. I've seen doctors since Eli has been, I guess, 3. He's 5 now. So for the past 2 years, I've applied and, went through the process and had seeing a chiropractor and, losing weight and, doing all the things they tell you to do. And, of course, breast size was not going anywhere. And then after nursing 2 boys for extended periods of time, my breasts were long. They were long. They didn't have a lot of volume at all. So without a bra on, literally there was probably an inch between my navel, my belly button, and my nipple. It was crazy. But you spend the extra money and you get the good bra, so when you're dressed, you look nice. But I was always constant back and shoulder pain, neck pain, and even the chiropractor wasn't going. I was going to the chiropractor 3 times a week and still was not able to really just find consistent comfort. I'd feel good the day that I went to the chiropractor, and then after that it'd be okay, I get 24-hour relief, and then it's back to the aches and pains. So finally I just was so over this summer I went in for my annual mammogram. I've been having mammograms since I was 30, because I'd had something. I think I found a lump when I was 18, 19. So I've always kind of had to monitor my breast tissue and making sure everything was good. So I've periodically had breast exams, mammograms, whereas typically I think insurance doesn't cover them until you're 40. I think is when insurance companies say now you're at the age where you should get your breast checked. But I've always had them done earlier. So I was going in for my annual mammogram this summer, and everything came back clear. No traces of cancer found. And I was yay, great. Well, the week after that, on my right breast, I began to have this bloody discharge from my nipple, and of course went in to see my OB. You know, they did a breast exam in the office, of course, didn't feel anything, and I didn't feel anything either when I went in to do it, and when I was doing my self-checks at home, but my breast was like feverish and like super tender to the touch. You know, so I'm like, something's wrong, you know. So initially I saw the nurse practitioner the day that I went in to the doctor, and she was like, well, you know, just, you know, give it some time, and if it, you know, happens again, then we'll refer you to a breast surgeon. And I'm like, no, thank you. I'm not waiting for this to happen again, because, you know, it could be 6-8 months from now. Who knows when this is going to happen again? And I don't want to give whatever's happening a chance to fester and grow. So I went ahead and told her to go ahead and make the referral to the breast surgeon ASAP. So, you know, with COVID, it took a while to get appointments and stuff done, but eventually got in to see the breast surgeon. She then scheduled me for like all sorts of labs and blood work and ultrasounds. And when I went in for my ultrasound, they did the ultrasound, and the ultrasound tech, I think that's what they call them, she kept going over the same spot over and over again. So I'm like, okay, something's going on. But, you know, of course, they're not allowed to tell you anything. So she called in someone else. And then when she did it, they were like, yeah, we're going to send your lab results up to the doctor, and the doctor give you a call. So, you know, of course, now you have to wait a week or so for another appointment. So when I finally get in, the doctors just, they called me. And was like, you know, we can't get you to come in. So I go into the doctor, and they're like, so basically we don't see any signs of cancer, but you do have enlarged ducts, and depending on, I guess, like hormonal influxes, it could cause your body, your ducts were being inflamed or whatever, were being, there was like inflammation, which was causing the bleeding and whatnot. So I mentioned to, you know, all the doctors during the course of this, like, you know, this is not something that I want to go through, because repeatedly, because it's scary as heck. And, you know, I just would really rather reserve, park, and, you know, get this taken care of. And again, like I said, I've been denied by the insurance company for forever. I feel like every time I go, they find some reason not to cover my breast surgery. But I was like, you know what? There's no better time than now to take care of myself and to give myself the best shot at being around for the long term, and see my kids grow up, and to basically just improve my quality of life. So I did an application with Care Credit. The surgeon that I saw, I was super comfortable with her. This was my second. I'd seen other breast reduction surgeons, cosmetic surgeons, before, but when I met Dr. Koo, she was super, like, I don't know, she just got me. She got what I was going for, what my issues and concerns were, and I felt super comfortable with her. Even when we were discussing like what size I'd like to be post-surgery, I felt extremely comfortable. Her office does accept Care Credit, and they offered 24 months 0% financing. So I applied for Care Credit, was approved for it, and that began the process. Surgery was scheduled for December 10th. Out of pocket, I paid $2,100 for the surgery center. It was at a hospital, St. Luke's de Pere Hospital is where my surgery was performed. Paid $2,100 for that, and then anesthesia was $910 that I paid out of pocket, and then I financed through Care Credit $9,800, and that was for the actual breast reduction procedure. Went in. Due to COVID, they only allowed one person to come back with me, but my oldest son is still doing virtual learning, so they dropped me off, and I pretty much did the pre-op, waiting period by myself, which was cool because, I was just kind of able to chill out. The doctors came in, they did all the testing that they needed to do. Once they gave me the good drugs and the IV, that I had not a care in the world. And I was not nervous about the procedure to begin with. I've been under general anesthesia before. I have a good relationship with my Jesus. So I said a prayer and, was not nervous or, I don't know. I just didn't have like the jitters of like surgery and all that stuff. So, I sat on FaceTime, not FaceTime, I don't have FaceTime, but I've sat on Duo and talked with a few friends while I waited. And then once we went in for the procedure, I came back out. Like the doctor came in, and when she marked me up, like it was like roadmap construction or whatever, which was, interesting in and of itself because of the markings. It's like, how do you make all this match up? But anyway, so surgery's done. I go home. First 2-3 days, I needed a lot of assistance because my range of motion for my arms was very limited. So I was having trouble wiping myself after using the bathroom. So Ian helped me out a lot with that. I didn't get to take a shower for, I think, about 4 days before they removed the dressing and everything. It was like, you can go ahead and shower. And Ian helped me like wash my back and stuff, of course, like that. Maybe that first week he's assisted me with that. I think around day 4 I was able to use the bathroom without any assistance, which was great. I needed help putting on, like, most of my pajamas and stuff that I had bought was buttoned down, but like when I would put on like a t-shirt or something, I would need help to, just kind of get it over my head. When you first come out of surgery, there's like lots of tape on your incision lines. So I was able to get all the tape off by week 2, all the tape was gone. Now I did have a complication because I was messing around with Eli, and he did one of those numbers and boom, hit me right in the breast, and it hurt like hell, but it also like split the incision a little bit. So I started to have some bleeding, and then I was eating Burger King. I think Ian had brought me Burger King, and I was sitting and eating, and within 3 minutes of eating Burger King, I had to throw up. And so like the act of vomiting, like I could feel as I'm throwing up, like I'm holding my breath, because I can feel like every time I do that upchuck motion, I can feel like this searing pain in my breast, but there's nothing you can do about it. When you throw up, you can't hold your pee, you can't stop other like things, because your body is doing like this involuntary motion or whatever, and like the pressure and the force of like getting things up and out. So of course, on one of my breasts, the incision split open, and it was it was just one of those things like, shit, what you gonna do? You just have to kind of let it, heal, go through the process and let it heal. So other than that, one of my tiny concerns was about keloiding. I have keloids on my shoulders and on my back. It's something that's very highly genetic, because my grandfather had them, some of my aunts had them. So that was like, it's a mild concern. But also I'm like, I would rather have scars and keloids any day over large breasts. During the surgery, they removed 8 pounds of breast tissue from my chest. So like when I say I'm literally lighter, 8 pounds lighter. So my appointment is in 7 minutes. It's this whole COVID generation, so I'll have to put a mask on and go on in. This will be my first time that my doctor has seen me since the splitting of the incision. So I don't know. She's very she's an artist. So she's probably gonna be like, what happened? And I'll just tell her what I just told you all. But I will come back. So I kind of just share with you all why I went ahead and bit the bullet on the $10,000 procedure. And of course, there are places that I could have, gone to Florida and got this done cheaper and probably got another procedure as well. But I have diabetes and high blood pressure, so I wanted to make sure that I was going to be in a place where if anything happened, my doctors would be here to take care of me in the event of, you know, something, you know, awful happening. So I, you know, I'm like, I would rather pay the money for that sense of security and peace, and knowing that I'm 20 minutes away from my doctor's offices in case of emergency, versus going out of state and having a procedure and then I'm back home and, you know, now I have to like go through this whole medical history situation. But I am very, very pleased to report, like, in the 3 weeks since I've had my surgery, I have been able to come down. My blood pressure medicine, I was taking 2. I'm now taking 1. And then my diabetes medicine was cut in half. So I was taking 2 a day. Now I'm only taking 1 a day. So once, I am super hopeful and like looking forward to getting clearance to start working out, because once I'm able to start working out, then that means that I can get like this extra like 10-15 pounds off of me, and then that should even like help me even more. My goal is to be able to come off of the diabetes medicine altogether, or to at least reduce the, like, now that I've reduced like the amount again, I want to try and maybe see if I can cut it, the dosage again. Like, you know, if I can cut the dosage again, that'll be cool. I just want to try and give my body the best chance that I can to just, you know, lead a healthy lifestyle and to be at its peak health condition. I'm 40. My mother passed away. She was 48. She passed away right before her 49th birthday. So as I'm approaching, like, you know, those milestones, like, my mama had a thyroid condition, that she didn't necessarily take care of properly. She would skip medicine. She would not take her medicine on time or at all sometimes, you know, just depending on how she was feeling. You know, she was a woman of faith, and she always would say that God healed me and I don't need to do this medicine. You know, I don't want to take this medicine. I don't have to take this medicine. And, you know, I just want to live. Like, I want to live. I want to explore. I want to be able to do things that, you know, my mom didn't get to do. So I'm taking the medicine, I'm doing the work, and I'm still having faith for healing. You know, that's not an indicator of a lack of faith, but it's definitely an indicator of, you know, learning from other people's mistakes, because my mom did not have to die at 48, you know. So that's kind of where I am in terms of like mindset and like overall like health goals. And I have a couple more minutes, and then I'm gonna run in and go ahead and get myself checked out. I'll give you guys an update, and then what I'll do is come back and like show you guys like pre-op pictures. So I'll show you with and without a bra, and then I'll show you before the surgery, and then I'll show you after the surgery. I'll have pictures from like week 1, week 2, and I guess week 3, I'll do some pictures when I get home today. And then I'll kind of put those at the back of this after this part of the video. And then when I get back in the car, I'll kind of let you guys know how this appointment went. So I will talk to you all later. I hope that you all are having a great holiday season. Merry Christmas late. Happy New Year's. Tomorrow's New Year's Eve, and I just hope that everybody is having a great time with their family, with their friends, and are finding ways to connect with people, even though we are physically disconnected from people. So, alrighty guys, see you in a minute. Alright guys, so I am done with my doctor's appointment. Everything went extremely well. I am healing as I should heal. The breast that got hit by my kid and that split when I was throwing up, she said it's perfectly fine, and that it's just going to take a little bit longer to heal because it heals from the inside out. And then it'll kind of flake off. And like I said, I've already seen like the scab is already formed, and so it's doing its thing. There's still like a tiny bit of drainage left on my left breast. But yeah, everything is going well. I will see her again in about 3 weeks. So I'll probably do another update at that time. So I'll do my updates as I have doctor's appointments, so to keep you guys posted. Excuse me. I don't want to die on the gram. There we go. Running low on hand sanitizer. But yeah, so super excited. I'm getting ready to head home, and then I'll show you guys, and then I'll tag on the pictures, like before surgery, after surgery, scar healing and all that stuff, because I know that's what people who are looking to have surgery want to see. So the progression of the scars. So I will insert like a bunch of pictures and stuff after this clip. So if I don't see or hear from you guys, I want you to have a great happy new year. Today is December 30th, so happy new year. And I hope that 2021 is a great year for you all. Bye.